Can we see her?
I can't see her.
Yeah, I'll just.
Is she there now?
No, I can't see her.
I'm just sending her message.
The meeting is live.
Meenakshi, you can start.
Yeah. So, good evening, everyone. And on behalf of NPSC, I extend a warm welcome to all in this webinar on dealing with holistic wellness during Omicron and beyond. Holistic wellness had always been important, but it has become a big challenge to deal with it now during the COVID times. Today, to help our viewers from, I would say, around the world, we have a very eminent and illustrious group of panelists who are going to tell us, guide us, and handhold us so that we are able to handle these Omicron issues. We have with us Dr. Arvind Kumar, who's the chairman of the Institute of Chest Surgery and Lung Transplantation at the Medanta Hospital. We also have Dr. Sameer Parekh, who needs no introduction with the school fraternity. He is the director at the Department of Mental Health and Behavioral Sciences at the Fortis Healthcare. Dr. Vikas Taneja is heading the Pediatrics Department at the Manipal Hospital. And last but not the least, we have an important stakeholder with us, Ms. Aparajita Gautam, President of the Delhi Parents Association. I extend a very warm welcome to all the panelists and thank you for sparing your valuable time to be with us. I would request Dr. Sudha Acharya to address and welcome us and take the session forward. She's the chair of NPSC.
Thank you, Meenakshi. Thank you very much. Namaskar and a very good afternoon to all the esteemed panelists. At the outset, I will request the host to allow all our principals who are waiting, even the panelist, Mrs. Aparajita Gautam, Ankit, she is waiting. Please allow all the principals. The panelist is waiting.
I think we've reached 100, Sudha, that's why.
Yeah, at least remove somebody and let her in because he has written me, I'm not able to join. So a very good afternoon again, a very hearty welcome to all the esteemed panelists today. We are here to discuss a very important issue which we all are going through. When in 2020, the school got closed throughout the world and we were confined to our home, that time teachers come up as Corona warriors and they took care so that learning gap doesn't exist or to try to minimize the learning gap. But I would say school is not the only place for cognitive development. School is also a space for social emotional learning. School also takes care of a lot of non-academic achievements of children like socialization or medical requirement or sports, games, all these things. So what happened is that when we are confined to home, we could see that both physical well-being as well as mental well-being got hampered. And within these 2 years, all of us school leaders here have experienced and heard heroic experience of our parents as well as our children. And what we see, child abuse, domestic violence, depression, aggression, feeling low, isolation. Even yesterday we heard of suicides of few school children of different schools. So these things have become very, very common. So even though we tried our best, we tried to develop that beautiful bonding between parents, the school and family partnership, even though it flourished during this pandemic, but there are a lot of gaps. So we are trying to bridge that gap. And with the vaccination started for the age group of 15 to 18. And yesterday it was in the news that it is approved for the market also, as if it will be available maybe by the chemist or something. And there are a lot of rumors regarding Omicron also. During this deliberation, it will come across, but we want to clarify all these doubts with our eminent panelists. So now I would invite Mrs. Meenakshi Sahani, Principal Modern School, to moderate the session. Meenakshi, up to you.
Thank you. Thank you, Sudha. Before I start, I would like to know whether Dr. Aparajita has been able to join. I can't see her. All right. Has she? No. Okay. All right. So we'll start and when she's visible. So thank you, Sudha, for trusting me with this responsibility. And since we have a rather airtight session, we just have about 50 minutes now, as I'm keeping an eye on the clock as the moderator, I'll quickly hit the theme. And the flow of the discussion will take place as follows. I will allot 5 to 7 minutes to each of the panelists to give their thoughts and viewpoints as we stand at this very crucial juncture now, with all kinds of opinions floating around in terms of whether schools now should be opening or not opening, and where do we stand vis-a-vis the virus. So starting with Professor Arvind Kumar, over to you, sir, and thank you for joining us this afternoon. We know you're busy, and of course you deal with the most delicate part of the organ of the human body. And I have one query before you get into, to bring us to, understand your side of this happening of catastrophe as I look at it, which is this, that schools across the country in different states have started opening up. In Delhi, however, we are still circumspect. And does pollution in any way increase our vulnerability and that of our children to the incidence of virus is one thing that comes to my mind and is uppermost. Over to you, Professor.
Okay. Distinguished principals from various schools in Delhi, NCR, distinguished other guests, friends, ladies and gentlemen, a very warm good evening to all of you. And my humble and sincere thanks to NPSC and each one of you personally for this very prestigious opportunity to address all of you. It's indeed a singular honor for me to be addressing this elite gathering, which influences the minds of millions of our children. It's a very, very precious group that I'm addressing today. And therefore, in my introductory 5 minutes remarks, I would be answering Dr. Meenakshi's question towards the end. But in the first 5 odd minutes, I would just place the current COVID situation in perspective, particularly with regard to various issues being raised about Omicron and its comparison with the previous episode. So we had the first wave in 2020. We had the second or the catastrophic Delta wave in April, May 2021. And we now have the third wave, which is driven by the Omicron variant. As we are all aware, this variant is basically has undergone a lot of mutations in the spike protein and other parts of the virus, which has led to a couple of major differences. And I'll just highlight the 4 major differences. Number one, as we all know, this virus is highly, highly infectious, far more infectious than Delta. That's number one. Number two, it's causing up till now, whatever data, and I'm talking of data emerging from our country, the experience in the last 1 month or so. So looking at data from Delhi, from my own hospital, from other colleagues in the city, and from the reports emanating from other parts of the country, and during our conversations with our colleagues across the country, what we learned is that up till now, the disease that has been caused by this virus has been relatively milder. And the major differences have been that the earlier disease used to have fever lasting 5 to 7 days, sometimes even going into the second week. This time the fever typically is lasting about 3 to 4 days. Many patients are actually not having fever. They are having sore throat and URI-like symptoms. Other symptoms are there, but a major difference that has been noticed till now, and I would repeat this word till now, because we don't know what's going to happen in future. Till now is that the incidence of lung involvement and consequent oxygen-related problems which we faced in Delta last year till now has been reported to be very low. And mainly it has been confined to people who have either not been vaccinated or they have a lot of comorbidities, 60 plus, with diabetes, hypertension, heart disease, cancer patients, liver, kidney, and otherwise
May I
healthy.
request the audience to kindly mute themselves, please? An earnest request. Thank you.
So healthy young adults, most of the people have been having a mild disease. So this is the second difference between Delta and COVID. The third difference is that the vaccine unresponsiveness has been reported to be much higher. So although Delta also evaded the vaccine response, so it did occur in people who had been vaccinated, but that problem is being seen far more with Omicron as compared to what we saw in Delta. However, there is a very important message that I would like to give, and that's point number 4, is that although vaccine unresponsiveness has been noted, but what has been noted is that a vaccine may not have prevented the infection from taking place, but what vaccine is ensuring is that the people who are getting infection are usually remaining as mild infections and not going into severe. I'd like to just quote one data given by the Bombay Municipal Commissioner a couple of days back, where he analyzed nearly 2,000 patients who were admitted across various hospitals in Mumbai who were on oxygen. And when they looked at the background of these people, they found that 96% of these people who were admitted and required oxygen were unvaccinated, which goes to say that people who are vaccinated will have protection from the disease, which may not be 100%, but in case they get disease, it's likely, 100% is nothing in medicine, it's likely to be milder. They will not require oxygen, they will not require ICU admission, and the death rate is very lower. So few things emerge very clearly. Number one, vaccine has a huge role to play, not only in preventing the disease from occurring, but also in converting it into a mild disease. That's a very clear message that anybody who's not vaccinated, I consider our sacred duty to induce them, to tell them that they should get vaccinated. That's number one. Number two, this infection is milder, but I would like to issue a note of caution that a lot of people are spreading this message that it's a mild disease like flu. We all should go and embrace the disease, strive for a herd immunity, and be done with it. That's a wrong statement. WHO has given a clear-cut warning that it will be a very serious mistake to consider it something like flu and try to get a herd immunity. COVID appropriate behavior. N95 has been proved to be a most effective. So this is the most important protection. N95 worn properly, worn all the time, and not removed even during having cup of tea or lunch together, because that has been shown that in the office, people who are wearing it most of the time, but remove it for 5 minutes to have a cup of tea together. And that's a very important message for all of you principals, that you would have some visitors coming and they'll say, okay, let's have a cup of tea. And out of sheer courtesy, you're likely to remove, or to have a cup of tea, you're likely to remove your mask. And that 5 minutes of having a cup of tea together with somebody in the same room may actually transmit the infection from you to him or from him to you. So this is a very important message, that mask has been proved to be the most important. Physical distancing is important. People collecting in closed space, unventilated or centrally ventilated closed space with same air circulating also has proved to be super spreader. And of course, hand hygiene. So mask, physical distancing, not coming in close contact, and hygiene. These 4 steps of COVID appropriate behavior with use of vaccine. This is our most important, most potent weapon to prevent the spread of this disease. As of today, it seems that by another 2-3 weeks, we might be able to overcome the numbers. It's early days, but the trends are that maybe by mid-February, we'll come out of this current wave. However, we need to see really which way it goes. But the important message which I would like to share with all of you, and I would like all of you to share with the millions of people you will be influencing, is that COVID appropriate behavior and vaccine are 2 important things that we must continue to practice rigidly if we want to get out of this corona situation. Now, lastly, coming to Madam Meenakshi's question, it's been proved beyond doubt in research papers from across the globe that pollution afflicted communities have higher incidence of acquiring corona, and if they get corona, they are having higher complications and higher mortality. There is data from China, Italy, other countries in Europe, and a beautiful study reported by Harvard from many counties in US, where they have shown a direct correlation between rising pollution levels and rising incidence and mortality due to COVID. So yes, if there is a pollution afflicted area, that area will have a higher problems due to COVID. Thank you very much. Over to Meenakshi, madam.
Thank you so very much, Doctor. You made it sound so simple and you allayed our fears, yet you have given us the responsibility of ensuring that these weapons are passed on. And yes, in Delhi, obviously, the problem is twice over, considering that pollution is something we haven't been able to get rid of. Thank you once again, Doctor. I'll now move on to Dr. Parekh. Dr. Parekh, we all know that the environment makes the man, and we are all products of the environment, and that includes the physical world around us and the air and the water and the food, and of course, the energetic world around us. Our children have been confined within the 4 walls of their homes for nearly 2 years, and their environment has pretty much little to give to them as compared to the kind of environments we grew up in as in our growing years. And we turn to you, Doctor, to share with us your thoughts on.
I think you're mute. Last portion is mute.
I'm so sorry, I missed it. I said, Dr. Parekh, we turn to you now, because they say that childhood shows the man just like morning shows the day. Our children's childhood is very different from what our childhood was. They are the products of an environment which none of us could have ever imagined or seen. And it's over to you to guide us as to what is it that we expect as an outcome. Of course, we all are getting signs and symbols all across everywhere. However, to get a holistic view of how we should be looking at it and how should we be preparing for it, over to you, Dr. Parekh. And thank you for joining us.
You know, their childhood has been different to ours, but we are the perpetrators here, aren't we? We've kind of collectively, our generation and a couple of generations associated up and below ours, have kind of created this environment that are in such an unfortunate impact on the water and air of children, or whether you take the impact on the overall well-being of children, we are responsible for it. We talk about children getting habituated to social media in a maladaptive manner. We brought it in their lives. Now we talk about from role models to everything. I mean, adults need to realize that we've kind of messed up, and COVID has given us an introspective opportunity to look within ourselves, redirect, redefine, and figure out a better way, because the way that we were functioning was clearly not good enough. And until we are honest enough with our own selves, we really will not be able to move forward and learn from this. Lots of people have been asking this question for the past 2 years. children not going to school? Frankly, there is no clear answer to that. Because what do you compare it to? Like what Professor Kumar was talking about, we've gone through transitions. We've all been evolving in our understanding of an illness that we had no clue about. So there can't be an answer. Of course, children should be in schools. It goes without saying. But then we didn't know how safe it was. Adults needed to ensure COVID-appropriate behavior, but we are not we've not been very smart when it comes to collective responsibility of COVID-appropriate behavior. We have to accept that as well. Every family that went to a film theater needs to question itself. How did they contribute? Every time we talk about children in school, ask a basic question. How have we delayed and played a part? I mean, for me, 2021 was a very important year because that was also a year without board exams. So all of us here, especially those associated with education, can at least now tell the future generations, life continues. Yes, exams have their own meaning. We are medical professionals here. I cannot say that exams don't matter because they do it in their own way. You know, we've given so many exams to be able to finish our qualifications, and obviously with a certain pressure of marks. No debate around that. We can't reduce the impact of marks or reduce the impact of academics. But we can't make it academics and schooling only about it. And that's something we need to understand. We cannot say, don't go on social media. That is the stupidest thing to say. Because the moment you say you don't go, the first thing an adolescent, a young teen is going to do is explore that why are they saying not to go there. You talk about how do you use it. Yes, there are concerns around children, especially younger children. But the only way forward is what do we do in the given situation? In my opinion, schools who were able to do whatever percentage of online education have done a remarkable service of humankind, because overnight shifting from physical to digital education is an impossible task, which happened because of the backbone of the teaching community, which does not get the adequate credit in most societies, unfortunately, world over, which is unfortunate. But the teaching community's effort needs to be recognized, like how frontline workers' effort needs to be recognized. Colleagues like Dr. Kumar, Dr. Nijat, hats off. Imagine going to the hospital, coming back home. What a remarkable thing. It's all fine for people like us to sit at home and do digital work and complain about digital need to do a digital detox, but doing that work is remarkable. Now, those are the learnings. Education needs to pick the right aspect of learnings. So, for example, the learnings of what frontline workers and medical practitioners did, that's a learning, inspirational learning for children. How we were adaptable. We adapted to the best that we could. Yes, some people don't wear masks, but lots of people won't. That's adaptability. We figured out work from home, adaptability. There are so many stories of one family having an illness, neighbors sending food. These neighbors wouldn't have met each other for a decade plus, and they were able to rekindle association, which is social development. So children should be exposed to that aspect. Utilizing the same social media for positivity, messaging, advocacy, and connectedness. Whether if you are a younger adult connected to your alumni, most of your alumni, and I've probably talked to almost most of your school's alumni in the last 1.5 years for some reason or the other, for some medical or psychological help that they needed. How? Because the bonds created in schools were able to look after each other. School alumni have done a remarkable work in the last 1 year, probably stronger than most other bodies if you look at it in RWS. These are learnings for us. But I also feel this is also a time for education to redefine itself. Marks, yes, Academics, yes. Physics, chemistry, biology, human sciences, everything, yes. But we need to integrate in the most undiluted manner mental health curriculum in schools, media literacy in schools, and we need to ensure basic counseling skills for teachers and psychological first aid. These aspects have to be now incorporated, and that is now. Because if we don't do it now, we would have missed the bus all over again that we should have boarded about a decade and a half or 2 decades back. So we talk about an incident when it happens. A group of kids talking some things that we are uncomfortable about on one social media platform, suddenly our eyeballs pop up. You saw one, which means there are thousands happening. It's always the tip of the iceberg that we notice. We hear about loss of a life or an attempt to the loss of life at one. Imagine what would be happening otherwise. What do you do about it? You talk about stigma, lack of help-seeking behavior. What do you do about it? So schools need to integrate proper, well-defined mental health curriculum. It's a simple way to do it. Training teachers, 5 or 6 basic modules which are defined. There are books written, including myself. We've written a mental health curriculum available for any school. Just take it, use it, right? And train teachers so that they use those 10 years that they have children for to be able to incorporate basic mental health training. Do not forget the undercurrents of mental health continue to be there. They've only taken a slide up because of the pandemic of COVID. You are more likely in your lifetime to provide psychological first aid several times over than physical first aid. But we all have physical first aid chambers and rooms and provisions, but we do not value psychological first aid. There aren't enough counselors. There will never be over the next several decades. There aren't enough mental health practitioners. They will never be for the several decades. In my lifetime, I will not see the right number. To give you an example, ratio of psychiatry to population in high-income countries is 70 to lakh. In low and middle, it's 1 to 2 to lakh. We are there. So it's not going to happen. What is the alternative? When we utilize teaching community, basic counseling skills, so that you reduce the over-expertization need of mental health, create layers. So I believe general physicians, family physicians, Anganwadi workers, pediatricians, everybody needs to be able to deal with basic mental health problems so that lesser and lesser problems would be needed for the so-called mental health experts because there aren't many. That's why I come back to the mental health curriculum, have a strong life skills based approach. In all schools collectively, the problem is some schools do, some don't. There is lack of consistency, but the milieu of children is the same. It is that milieu which has a heterogeneity, which impairs the collective learning of that group, because somewhere the learning is happening, somewhere it's not happening. So the importance and value is not being created. So yes, mental health curriculum, psychological first aid, media literacy. Do not complain about social media if in your school you do not have media literacy incorporated for your children, because you have a solution. First try that, then let's solve the problem. But our collective thought process, parents, educationists, adults, everybody is switch off the phone. Why are you on social media? Why do you have this? Why do you have that? What else? We've not created avenues. We've not told them use it, but in a certain way. I think these are the things we need to look at. COVID is a unbelievable experience. I mean, I still can't believe that this is what has happened. I haven't gone to the hospital for a year and a half. I had one meeting yesterday for 2 hours and now I'm in isolation. Because in the morning, I got a message from my colleague who had to meet me yesterday, tested positive, isolate yourself, right? Life. Have been doing patients consults exclusively digitally, something that I have never done in my life. And you know, when 50 years are gone and you have to work digitally, it's an absolute challenge. When even the smallest thing happens and I don't know what to do with that. So that all happened. We were never trained in medical colleges about pandemics. we have never read about it. We've taught children history of world wars, which collectively had less mortality than the pandemics. It reflects on how humankind has been. We have an opportunity. Life has given us a teaching moment. Are adults willing to learn is the only question.
Thank you so very much, Dr. Parikh. And I loved some of the terms that he used. And of course, these have to be translated into action. The first being psychological first aid. I think this is something, the skills for these are definitely on our must-do list, as also, of course, integrating a curriculum for mental health and training of teachers all across. We need to really step back, introspect, and redefine and use and turn the areas of weakness into strengths, like you say, use the social media to our advantage. Thank you, Dr. Parikh. I think we have a lot of takeaways from your talk, and it means the world that you came and spared your time for this today. We will now move to Dr. Taneja. Dr. Taneja, thank you for joining us. And before it's over to you, I have to say that the one thing that doesn't fail to surprise us is, as principals, and I think everybody would agree with me, is that our children are going to malls and there is no vaccination expected, or nobody looking at vaccination or factors such as those, even for 15 to 18-year-olds when they enter a mall. But schools are a no-no. And the other aspect is that I think in my range of experience, the number of students who have got spectacles, eyeglasses, their eyesight has gone bad, or who have become obese in the last 2 years has touched never before highs. And these are just some of the things that are uppermost in my mind. But of course, you have seen probably much more. So it's over to you, Dr. Taneja. We welcome your thoughts.
Thank you, Meenakshi ma'am. And once again, I thank NPSC for inviting me. Yes, Dr. Sameer Parikh as well as Dr. Arvind has made my job a little easier. They have given a good overview about Omicron. I think that is very, very important for all of us. Second, about the psychological aspect and how the problem has been created. It's not that something has happened, but probably we adults are responsible for it. And so based on these 2 points, I would just like to give the perspective how kids are going through. Yes, we know that COVID has affected children also, and with the present variant of Omicron, we are seeing kids almost equally affected as adults. So it's not that adults are getting affected and children are spared, they are also getting affected. But what I have always believed is that we should look at the positive side of it. Right over the last 2 years, we have at least gained some knowledge about this pandemic. We have learned a lot of things. It was a gradual process. It started and we have gone through it and we have learned a lot many things. And one thing which has been very, very characteristic is that the disease in children across, whether it was the first wave, whether it was the Delta wave or the present Omicron wave, the disease across children has been mild. So that is one good aspect of it. But the bad point about this is that parents have been so much stressed about COVID is that they have stopped looking at everything else. I think that is what over 2 years as a parent also, I also feel we have learned that thing, that it is our panic which has led to shutting down of schools, not letting the children go. If we look at the policies or the government is not someone who have come just on their own. Government is just following the advice of the experts which are sitting there, advise what the parents are thinking, how things are going about it, and probably that has created the whole scenario that schools should be shut. Yes, you raised a very, very valid point that children are going for holidays, children are everywhere on the hill stations, children are there in the malls, children are there in the theaters. They are getting exposed there also. So just closing the schools is not the answer. I don't believe that is the answer. But yes, since the children have not been exposed to the regular schooling, their peer group, and that has led to a lot of stress on children. So whether it is a physical stress or feeding habits or their sleep patterns or social media, you name anything. It's not that they have suddenly resorted to all those things. They are seeing the adults. Parents are also going through the similar phenomena. They are doing work from home. If they are not on their work, they are on social media, they are on digital screens. So it's whatever the children are doing, they are seeing and they are following it. Now, if we have seen families where they are taking out everything on the kids, just don't follow this, just keep studying, keep studying, keep studying. I think that is not the solution to the whole problem. We will have to look at it collectively, and I feel it's a very, very good point that that principals across schools, educationists, teachers, they are coming out with this, and it's high time the government will have to look into it and consider it. Yes, the disease or the pandemic will keep going on. It is not something which is here for 2 years and it will not be there tomorrow. We are the COVID is here to stay. We have to learn to live with it. Today it is COVID. Tomorrow there may be some other virus. So I think that very important learning needs to come in, that whatever is happening, just take the learnings out of it. The way we have done it, how we handled the pandemic, how we are handling the vaccination, how we are handling the cases in the hospitals. To start with, we were nothing. We were not even prepared that such a large chunk of people will land up into hospitals, and we have handled those. So hospitals now are much, much better prepared during this third wave as compared to what we were in the second wave. Similarly, the schools also, once they started opening, once the sessions, the trainings of the staff were done, we actually found out that there were lots and lots of gaps which need to be covered. And we worked on to that. But now we are facing a totally different problem. Schools are opening, shutting, opening, shutting. I mean, that is creating more damage, what I feel, as compared to what it was in the beginning. There was a certain period, the schools were closed for a certain period, they opened up and they should have remained open. Now people talk of that children are not vaccinated, so it's more dangerous to send them. But I'll want to quote out here is that after the first wave, after at least during the second wave, when the government tested children for the presence of antibodies, they found out that even if the children were getting mild disease or even if they were not exposed, 75% of the kids who were tested were already COVID antibody positive. So, which means already that herd immunity factor has started coming in. And it was not a small group, it was almost 70 to 80,000 kids who were tested. So, in a way, they got the antibodies because of a natural exposure. Yes, getting the vaccine, it will be boosted, but it is not that they have not been exposed at all. It is not possible. If adults are getting exposed and getting the infection, in due course of time, children get exposed, they may be symptomatic, they may be asymptomatic, and they develop antibodies. So right now, if you look at vaccination, yes, good, it has come for 15 to 18 years, and it will come for the children 2 to 15 years of age also. But they have already developed some bit of antibodies. They already are getting the disease which is mild. We don't know what the future is, but just because of that fear, we are not letting children do what they should be supposed to. So my take on is that yes, there has to be a political will to it. It cannot happen at individual levels. We can hold webinars, we can have n number of discussions, but we cannot work on this individually. Even if all the schools come together and they make a plan of action, how things need to go, if there is no political will, it will not come to the ground level. So I think that is very, very important perspective, which if how it can be taken to the government, that needs to be seen. But yes, things are workable. It's high time we should look at beyond the physical health. We should look at the mental health of children. we should be equally worried about. We should not be hesitant to talk about it and discuss about it. And as adults, we need to change if we want to see that change in children.
Thank you so much, Dr. Taneja. You're very, very heartening to know we are on the same side. And this might very well be the first step in the right direction.
Yeah.
And, maybe provoke people to kind of take notice and act on it. And thank you once again. And I now turn to Dr. Parajita Gautam, who is the president of the Delhi Parents Association, the primary stakeholders in the matter. But before I hand over to you, I must tell you that we have 5 to 7 minutes because you could not join per panelist. And to begin with, if I had to ask you for a one-word response to, are you ready to send your children to school if they were to open in the first week of February, what would be your response, Dr. Parajita? And you can be politically incorrect. It's all right. You're on mute. We cannot hear you. You need to unmute. Can she be helped? Maybe you just need to refresh.
I've sent the message to unmute.
All right.
Yeah.
If she's having a problem in muting and unmuting, she can log out and log in quickly.
Yeah, we have told her that.
Yes. And while she's joining, Professor Arvind, may I know, is there any special need for schools to kind of equip their medical rooms in anticipation of reopening? I mean, we have our basic medical rooms everywhere. Would there be any advice on the matter? You're on mute.
Rajita ma'am is here now. She's unmuted.
Yeah.
Okay.
Can you see me? Actually, I can't see myself.
Yeah, we can see you.
Yeah, perfect, ma'am. Because I cannot see myself. Let me start with Meenakshi ma'am was asking. Ma'am, आपने जो question पूछा, yes, because that depends कि मेरे बच्चे का age कितना है, because my son is with the ITL school only.
Okay. So the answer is okay. So the answer is yes in one word.
Definitely, yes.
Okay.
Because we all know that vaccination has been started. 3rd of January से शुरू हुआ है और जिस एज ग्रुप में मेरा बेटा आता है वो इसी एज ग्रुप में आता है जिनका वैक्सीनेशन शुरू हो गया है. बट जब हम स्कूल खोलने की बात कर रहे हैं तो ऑब्वियसली क्योंकि ये टाइम में जस्ट आप लोग स्कूल चला रहे हैं, यू नो दैट जनवरी एंड होने वाला है और फरवरी में बच्चों की एग्जाम्स हैं. एज अ पेरेंट फॉर मी व्हाट इज द यूज ऑफ ओपनिंग स्कूल फॉर द सेक ऑफ 15 डेज. ये मैं बात कर रही हूँ क्लास टिल 8th तक. तो मैं जस्ट आप लोगों के प्लेटफॉर्म में यही कहना चाहूंगी 8th क्लास तक अगर हम अभी भी अवॉइड कर जाएं, बिकॉज अभी उनका वैक्सीनेशन नहीं आया है और हम सब जानते हैं अभी गवर्नमेंट ने अनाउंस किया है कि मार्च में 12 to 14 ईयर्स तक के भी वैक्सीन अवेलेबल हो जाएंगे. तो मेरा जस्ट यहाँ पे यही कहना है कि अगर हम 9th ऑनवर्ड्स अगर हम स्कूल्स को रीओपन करते हैं क्योंकि इनका वैक्सीनेशन भी अवेलेबल है, तो आई थिंक ये एक सेंसिबल डिसीजन होगा जिसमें अगर आप लोग भी गवर्नमेंट को लिखते हैं, वी आर ऑल्सो रेडी टू राइट द लेटर टू द गवर्नमेंट कि आप इन बच्चों के लिए ओपन कर दें, क्योंकि ये जो 15 डेज होंगे ये बच्चों के क्रूशियल डेज होते हैं. कुछ अपने डाउट्स होंगे जो क्लियर करने होंगे वो बच्चे अभी स्कूल जाके कर सकते हैं. एंड इफ आई एम नॉट रॉन्ग ITL के 2 हफ्ते बाद इनके फाइनल एग्जाम्स भी होने हैं. यस, आई एम रेडी टू सेंड माई वर्ड टू दी स्कूल फ्रॉम 1st of Feb अगर वो अनाउंस होता है, क्योंकि बॉम्बे में 24th of January से स्टार्ट कर दिया, मंडे ऑनवर्ड्स जा रही हैं. एक चीज मैं जस्ट आपके प्लेटफॉर्म से मैं माफी चाहूंगी, मुझे पता माई टाइम इज वेरी लेस. लास्ट में मैं कहना चाहूंगी क्योंकि डॉक्टर अरविंद ने एक बहुत अच्छी बात कही थी, पॉल्यूशन और कोविड का आपस में रिलेशन है एंड हम लोग जिस दिल्ली में रहते हैं यहाँ पे पॉल्यूशन लेवल बहुत ज्यादा है, तो दैट मैं आप सभी डॉक्यूमेंट से कुछ क्वेश्चंस मंगवाए थे। एक मेरे पास बहुत इंटरेस्टिंग क्वेश्चन आया है, किसी बच्चे का अगर IgE सेरम 3000 हो, जो लेवल में मैक्सिमम 170 होता है, क्या उस बच्चे को भी वैक्सीनेशन लगवाना चाहिए? ये कोई भी डॉक्टर हैं जो यहाँ पर अवेलेबल हैं, प्लीज मेरा आंसर दीजिए, क्योंकि ऐसे छोटे छोटे क्वेश्चन है जहाँ पेरेंट्स कंफ्यूज हो रहे हैं। मैं बता रही हूँ, रिपीट कर रही हूँ, एलर्जी टेस्ट करवाया बच्चे का, IgE लेवल 3000 आया है, जबकि उसका मैक्सिमम लेवल 170 होता है। बच्चा क्या वैक्सीनेशन फिर भी लगवा सकता है?
I do not know if these.
Want
Yes,
me to
Professor.
answer?
Yes,
Yeah.
please, Dr. Taneja.
ओके, सो अपराजिता मैम ने जो क्वेश्चन रेज किया है कि IgE लेवल बहुत हाई है, IgE लेवल हाई होना इज नॉट जस्ट ओनली द लेवल, बट अगर बच्चा साथ में सिम्टोमेटिक है, उसको एलर्जिक सिम्टम्स है, देन थिंग्स कैन बी डिफरेंट। बट अगर बच्चा एक्यूटली सिम्टोमेटिक नहीं है, देयर इज नो कॉन्ट्राइंडिकेशन टू द वैक्सीन अनलेस एंड अनटिल कोई बच्चा जिसको वैक्सीन पहले, क्योंकि बच्चों को बाकी वैक्सीनेशन लगती हैं, अगर उसकी हिस्ट्री है, स्ट्रॉन्ग हिस्ट्री कि उसको किसी वैक्सीन के टाइम पे वैक्सीन से रिएक्शन हुआ है, then there is a word of caution. But beyond that, the only contraindication we can say, or a relative contraindication is, अगर बच्चा acutely ill है with fever or cough and cold, we say don't give vaccine at that point of time. Once the acute illness is over, the vaccination can be taken. IgE levels high है, उसका cause ढूंढ के उसको treat करना is a separate process which can go on simultaneously, but that does not mean कि वो COVID.
All right. Thank you, Dr. Taneja. I have to keep one eye on the watch. Dr. Gautam, would you like to say something? Your connection is a little unstable. We can't hear you. And if you have got the answer, can I very quickly move to the rapid fire round? Within 10 minutes, have all the questions
please.
from my team. So over to you, Sanjay, who is a part of the executive body. Sanjay, your question to Professor Arvind Kumar, please. Let's keep it very crisp. We have 10 minutes and lots of questions. Can you hear me, Sanjay? Okay, while the message gets across to him, Sudha ma'am, would you like to put your question to Dr. Aparajita?
Yeah, I would ask Aparajita ma'am, आज आप क्योंकि दिल्ली पेरेंट्स एसोसिएशन को रिप्रेजेंट कर रहे हैं यहाँ, सो आपने बताया कि 15 to 18 एज ग्रुप अगर वैक्सीनेटेड है तो हम उनको अलाउ करेंगे। अभी ये वेबिनार से पहले जस्ट हमारी डायरेक्टरेट ऑफ एजुकेशन से बात हो रही थी, मीटिंग हो रही थी, एंड वहां से पता चला डेटा से कि काफी सारे पेरेंट्स की हेजिटेंसी है फॉर वैक्सीनेशन। दे आर थिंकिंग दैट 18 साल हो जाए उसके बाद वैक्सीन लेंगे, एंड बहुत सारे पेरेंट्स को ये भी अवेयरनेस नहीं है कि ऑफ लेट कोवैक्सीन हैज बीन अप्रूव्ड बाय ऑल एजेंसीज। चिल्ड्रन आर गोइंग अब्रॉड आल्सो विद कोवैक्सीन वैक्सीनेशन, नॉट ओनली कोविशील्ड। सो ये अवेयरनेस आप पेरेंट्स को कैसे देंगे? बिकॉज पेरेंट्स भेज नहीं रहे हैं कि कोवैक्सीन तो अलाउ नहीं होगा, तो 18 साल के बाद मेरे बच्चे कोविशील्ड या और कुछ ले, उसके बाद जाके होगा। सो नंबर इज वेरी लेस। Just now we were having a macro view from the Directorate of Education. Many private school parents have vaccination hesitancy.
Yes.
आप उनको कुछ बोलेंगे इस प्लेटफॉर्म से? अपराजिता मैम,
she is not audible. I can't
I think
see.
इनका इंटरनेट कनेक्शन आज थोड़ा सा अनस्टेबल है।
So Sudha, then can I move to Meenakshi?
Yeah, please.
Meenakshi Kushwaha has a question for Professor Arvind Kumar.
No, thank you, Meenakshi Sani. My question is with Dr. Sameer Parekh.
Oh, yes, my apologies.
Dr. Parekh, that's okay. So Dr. Parekh, my question is that 85% of the human brain is developed by the age of 5 years. So what about those who have not been to school and they are already in the age bracket of 5 to 7 years? So what do you say that schools should do for them when they join, or parents or society? So just help me answer this question.
A couple of aspects. I'll be very quick on this. Anatomically or physiologically, whatever we may grow in a short time is a different issue. But psychologically, emotionally, socially, we continue to grow, and most of us actually should grow more, but we kind of stop growing. And there is still an opportunity, no matter what our age is, to continue growing on a lighter tone. But I would treat children the way I would have treated children irrespective, with an understanding that younger children who take a few days to adjust to a new environment, these children would take a bit longer. I'll give them more comfort of duration, going back, half day, more outdoor, more comfort, partial structure, which we do for young children in any case. I'll just widen that window a little bit, keep parents informed, ensure that the experience of being with peer group is a positive one. Learning will follow its path, but not rush into trying to focus on learning. Not to say that it shouldn't be there, because that structure also brings in a lot of development aspects. School as a structure, academics as a structure, periods as a structure. But I'd say that you just give them, widen the space a little bit. That's about it. And children are wanting to come to school, by the way. Give them an opportunity, they'll come today. Right, yes. Right now, the first thing that they want to do is go to schools. I haven't met a child who would say that I don't want to go to school, and that applies for very young kids to teenagers. Everybody wants to go to schools.
Right, right.
Thank you. That's encouraging.
Yes, yes. I think all we need to do is to, give them confidence, and we can do it together. Now, Asha, would you like to now put your question to Dr. Taneja? You're on mute, Asha. I think we are doing good with time.
Great insights from
Asha. Asha is there.
And, especially my question is to Dr. Taneja. They say that the virus is ever mutating, and also there's a lot of news which is pouring in that small number of cases of heart inflammation have been identified in teens and young adults, particularly after 4 days in the West. And it's all the mindset, and the parents get confused. And also now we heard that the rising pollution levels, they are also going to have an impact on the virus. And will the Delhi students, will be effectively vaccinated in comparison to the other students? And the vaccination for 10 to 12 years age group and below 10 years, is it going to be very effective? Because the reports which are pouring in from the West are not very positive. So in that case, would you like to throw some light, to us, so that we can also as principal convince our parents?
Okay, so I'll answer your questions as you have asked. The first part, when you say that that the heart gets involved, so understand what we have learned over the last 2 years is the data which we are getting is that the disease in children has been mild. Post exposure to the virus, after about 4 to 6 weeks, some children will develop an hyperimmune response to COVID. So that came as a multi-system inflammatory syndrome in children particularly, and it has been seen in children particularly. So the number of such children getting MISC is very, very less. So it's 1 in 10,000, right? So it is not that they are not getting affected. Yes, they can get this disease, but the numbers are very less, and it is a perfectly treatable condition. As of now, the mortality because of MISC has been very, very low across the world. It's not that it has not been there, but it is very, very low. So broadly speaking, if you look at any disease, mortality can be there. Yes, but we always look at percentages, and here the percentage is very, very less. Most of the kids would get a mild disease, would recover from it easily, and can be as normal as possible. The second part, what you talked about, is the vaccination. Now, one thing is vaccination, yes, it's not, as of now, it is not in our control because it is being brought in by the government. So government is going by the policy that the vulnerable groups are covered first, and then they come on to the children. Now, in children also, the most vulnerable group is either the very young or the young adults. Young adults, they have already started covering. So gradually from 15 to 18, they will move down to 12 to 15, then less than 12. But the efficacy data of different vaccine is coming with time. It is not available. Whatever data we are getting in our country also, our vaccine is being tested for 2 to 12 years of age. So once we have sufficient data, they will obviously go on to children less than 12 years also. If we look at the data from the West, now they say that the vaccine they are giving, but it is not effective. Now, when we say effectiveness of the vaccine, it is not that the vaccine effectiveness is not that they will not get the disease at all. I think that Professor Arvind also very clearly explained. The severity of a disease can go down. That is the most important point to understand. We don't know what COVID would behave 2 years from now. We may say that Omicron is causing a mild disease as of now, but say 6 months down the line, we see some other variant or other mutation and more problems started happening. Then where will we go? So we need to follow the COVID appropriate behavior. We need to get the vaccinated. We want to keep the disease to be less severe as possible. These are the things which studies have proven, and we have the evidence for it, and we should be following it. Rest all, whatever we are talking is just a pep talk. I don't think so. We should be believing all those things. The hard core evidence which we have is please get vaccinated. That is most important. Disease, if you have mild, well and good. If you have a severe disease, you need to be consulting your physician. You may need hospitalization, and that can be taken care of. I don't think so. From that aspect, anybody should be worried. We have enough preparations and facilities now available in the country that it can be managed. Whatever drugs, things which are available across the world are available in our country also. So we should not be worried about it. We should be looking at designing protocols and follow them religiously. People in the West have used a lot of medications. They have come out with the evidence that this is good, this is not good, this is working, this is not working. At the end of the day, the general principle is it is a virus. It is usually will be a self-limiting disease, should be treated like a normal virus, taking only symptomatic treatment, no antibiotics, no other things work. Wherever drugs are required, then the physician would definitely look into it and give those. But as far as children are concerned, we are very, very clear. None of the antivirals, anti-COVID medications which are coming in the market work in children. We just only give symptomatic treatment. We are seeing very, very less mortality. Children need to schools, get their regular routines. That is more important at this point of time. From our side, it should be not be that worried about the disease.
Yes, Dr. Taneja, I think if the examples of smallpox and polio really and how they've been eradicated from the world with vaccines should be a good confidence-inducing thought. Of course, the virus is different. And I'd like to thank you once again. And Professor Arvind, the last question I will, to wrap up the session, which I had asked earlier, do we need to equip our rooms, medical rooms in schools in any special way to combat things that we might not anticipate or face?
Thank you, Dr. Meenakshi. Part of the answer was given by Dr. Taneja, who very clearly said that antibiotics, antivirals, or any other such medicines have neither any role in adults and least of all in children. So when we have a child reporting fever, of course, the first response that we can do is to give them a paracetamol tablet, which is safe and can be given and is maximally being used in the treatment of this wave of COVID. The only other thing that I'm seeing a lot of children suffer, and even my children had this problem, was excessive cough during the episode of COVID, which initially usual gargles, etc. But when it was not settling, then nebulizer using inhaled steroid, so one of the preparation of steroid inhaler given in a small dose twice a day. So when the child is having this excessive kind of cough, at the best, if you want to equip yourself, probably a steroid containing solution given in a nebulizer form will do no harm to the child, even if you give it. That will be the max. Other than that, I would not recommend any special COVID medications to be stored in the school kits.
Thank you, Professor. And now it's over to Sanjay. Doctors, your presence.
No. Meenakshi, Aditi ma'am want to ask a question. We can extend 5 to 7 minutes.
Thank you.
Aditi ma'am, please come in.
Thank you so much, Sudha ma'am. My question is to all the doctors, the physical health and the mental health. So when the pandemic started, the children were subjected to a very sudden change, from regular school to online school. And now whenever we open school, there'll be one more very sudden change for them after 2 years to get up early, to catch a bus, to wear a uniform. So what would be your message to all of us teachers, principals and parents? What should we do to ease this change as much as possible, both physically and mentally?
I think this question also was partly answered by Dr. Parekh when he said that let the change be gradual. So maybe since, as you said, they've not been used to wearing the dress for such a long time, maybe you could give them a relaxation for the first few days or a few weeks as far as the dress code is concerned, not go very rigid on a schedule of classes from the day one. So first few days could be just discussing, okay, children, let's sit down and talk. How did you pass the last 2 years? Let me share so maybe the teacher shares her experience, which encourages the children. Ma'am, maine aisa kiya. Ma'am, aisa kiya. So, slowly over a period of few days or few weeks, we can get them back from home mode to school mode. And once they are back in school mode, then you people can come in the true teacher mode.
I would like to mention one point here. I would like to mention one point here.
Yeah, Dr. Taneja.
Continuing what Dr. Arvind said. See, I know younger children, there would not be any problem sending them to school. Problem will happen with the adolescents.
Yes.
They will not get up in the morning. They will not listen. They will. So what I feel is what the best way can be for the first few days, keep things relaxed. Point number one. Point number two is children who are coming to school, they should be, like Dr. Arvind said, if they are in their mode, studies, just a bit of it continuing, they are sharing their experiences. And the children who have not come, if they come to know what is happening in school, it should come from them that now we want to go to school. Rather than putting pressure that you have to come or they will be punished or they will be that. So if that comes from them within, they will be more than willing to come to school rather than creating circumstances where we push them to go to school. So I have felt this thing that adolescents, they want to take their own individual decisions. So there should be no parental pressure. There should be no pressure from the school. Things should start gradually, and over a period of say 15 days to a month, things definitely should come down to near normal. Yes, there will be pressure of studies, that is there, but studies have been going on. It's not that children have not studied during the last 2 years, though it has been happening. So I think that gradual change and coming from the children would make a lot of difference.
Yeah, very true. Very true.
You.
Yeah, Dr. Arvind,
one more small point.
Please,
the adaptive power in children is far more than us adults. So I see more problems being faced by parents in getting up early and making them ready, and maybe teachers in coming to school on time rather than children. For all you know, you'll be surprised how quickly they'll adapt to it and say, "Ma'am, padhana shuru kariye na, please."
Yeah, very true. Mrs. Aparajita, you are there. You wanted to speak. Is your connectivity better now?
Yeah, it is better now.
Yeah.
Thank you, ma'am. I definitely, I 100% agree with Dr. Parekh and Arvind. जैसे उन्होंने कहा, जैसे डॉक्टर पारिक ने बोला कि slowly gradually, और जो बच्चे ऑलरेडी स्कूल जा रहे हैं तो ऑटोमेटिकली जो एक पीयर ग्रुप का जो आपस में जो ट्रस्ट होता है वो डेवलप होता है, वो जल्दी डेवलप होता है। हम और आप कहेंगे तो कहीं ना कहीं वो ऐसा लगेगा प्रेशर दिया जा रहा है। एंड लास्ट में मैं बस यही कहूंगी, क्योंकि डेफिनेटली वैक्सीनेशन स्टार्ट हो चुका है, और जैसे भी अभी जैसे दोनों डॉक्टर्स ने कहा, हम प्रेशराइज नहीं करें। हमें कहीं ना कहीं बैक एंड पे बच्चों का 2 साल का एक डिफरेंट, सबके घर में एक डिफरेंट एक एनवायरनमेंट है, हर किसी को, हर कोई ब्लेस्ड नहीं होता। तो एज ए स्कूल मैनेजमेंट, स्कूल प्रिंसिपल्स, मुझे पता है यू ऑल आर वेरी सेंसिटिव, बट स्टिल एक छोटा सा एक पॉइंट मैं देना चाहूंगी कि स्कूल अगर कोई बच्चा नहीं आया है तो आप लोगों की तरफ से थोड़ा सा उसको कंफर्ट जोन ये दे दिया जाए फॉर द टाइम बीइंग। ये जो सेशन जैसे डॉक्टर अरविंद ने बताया है कि आप शुरू के 1-2 सेशन आप रिलैक्सिंग के लिए उनको दीजिए, सो जो उनका जो मेंटल है, जब आप पर्सनल एक्सपीरियंस शेयर करते हैं, आई थिंक इट्स अ वेरी गुड आइडिया। जब बच्चे आपस में शेयर करेंगे वो बहुत रिलैक्स फील करेंगे, और वो जो एक फ्रेंड्स का जो एनवायरनमेंट है, टीचर के साथ जो उनका बॉन्डिंग है, जो स्कूल का जो एनवायरनमेंट जो फील करते हैं, तो मुझे ऐसा लगता है कि वो बेटर डेवलप कर पाएंगे। एंड ये जो ट्रस्ट लेवल है वो बच्चे ही बिल्ड कर लेंगे, और ऑटोमेटिकली ये जब वो मैसेज देंगे अपने पेरेंट्स को, वो पेरेंट्स भी आपस में, क्योंकि बिकॉज आई एम हियर एज ए रिप्रेजेंटेटिव, तो मैं आपको भी पर्सनली बताऊं, हमारे बच्चों को स्कूल जाना चाहिए। शायद यही रीजन है मैं अपने बेटे को लेके कह रही हूँ कि 1 Feb से अगर खुलता है तो आई एम रेडी टू सेंड माय चाइल्ड, बिकॉज आई नो आईटीएल इज टेकिंग केयर ऑफ। तो यही चीज, यही जो ट्रस्ट लेवल है, मैं ये चाहती हूँ दिल्ली क्या इंडिया के सभी स्कूल्स में पेरेंट्स को ये कन्वे किया जाए, बच्चों को कन्वे किया जाए कि जैसे स्कूल रीओपनिंग का हो। और लास्ट में बस ये कहूंगी, जैसे बाकी डॉक्टर्स ने बोला कि ये सिर्फ आज ओमाइक्रॉन है, कल कुछ और आ जाएगा, यस, ये ईयर बाय ईयर ये चलता रहेगा। तो स्लोली एंड ग्रेजुअली हमें इसकी आदत पड़नी चाहिए, और हम डेफिनेटली चाहते हैं, दिल से चाहते हैं, जो बच्चे अपनी एजुकेशन से महरूम रह रहे हैं वो नहीं हो, और स्कूल कंटिन्यूसली खुले रहें, जिसके लिए हमें यह है कि आपस की अंडरस्टैंडिंग बढ़ाते हैं, तो डेफिनेटली विल अचीव आवर गोल एक्चुअली।
Thank you, Aparajita ma'am. Thank you. I had a little question for Dr. Samir Parekh. He was talking about mental first aid. So if you can, Dr. Parekh, elaborate that mental first aid and self-care package, because a lot of children are going through loss and grief.
That's psychological first
So
aid.
that has risen to fear. Talk about mental first aid and
Psychological first aid.
Psychological health aid.
fear psych.
So, ma'am, psychological first aid, right?
Yeah.
Try and understand this. If a child has fallen down, bruised their knee, come to you, what do? You clean the wound, nicely make the child sit, do a bit of a dressing, may or may not give a painkiller, probably even give a chocolate, okay? Something like that. Now imagine this child was bullied by another kid. Child scared, comes to you. You have to do the same thing. Non-judgmental, compassion, validation, affirmation, support, solution. That aspect is psychological first aid. Which means how does the first responder to distress give a response to an individual that individual's help-seeking behavior gets reinforced, and the struggle of that moment, that here and now crisis, can be taken care of. If psychological first aid is provided by peers, parents, teachers, then what happens is daily hassles, minor issues, initial problems can timely be resolved. And the other aspect was the mental health curriculum on your platform with your association. I am saying this with full responsibility. The mental health curriculum is an absolutely free of cost initiative, like all of our school mental health programs. It's a simple thing, a 1-hour training, 5 modules for all your teachers at one go. And then they can continue to use that for the whole 10-12 years of children, right from primary to senior. We're happy to support, partner you, your association, your schools, wherever you are in the country. And now that digitalization has allowed us that we can keep doing more and more trainings with all of the bandwidth that we have available, let's take a step forward.
Yeah, thank you. Thank you so much. I have the last question. Dr. Trilok Singh Bist has raised his hand. Yeah, please come in. This should be the last question. Then I would request Mr. Sanjay Yadav to propose vote of thanks. Mr. Trilok, unmute yourself. Yeah.
Good evening, Sudha ma'am. Good evening, all the panelists over there. Dr. Parekh, one thing I found that, after the second wave, we opened on 20th of October. For 2 months, we ran the school. Initially, first 2-3 days, we found the children were not coming. When they saw their peers are coming, they started coming. So I think that suggestion is very good that we should not force them for first 1 or 2 weeks. That's perfect. Okay. Then Dr. Parekh, we would want you to share your email ID for the teachers, which is free of cost, so that this mental health and social health of the children can be taken care of.
I just put the ID on the chat box.
Right,
Yeah.
right. Thank you.
Yeah, our students are also doing internship program from Dr. Parekh and all. He's so well known. So if you want, Mr. Trilok, I can give his mail ID. Otherwise, on the chat box, we'll do that.
Please do share on the WhatsApp.
Yeah. Thank you so much. Thank you. So now I invite Mr. Sanjay Yadav, Principal Alkan International School, to propose a formal vote of thanks.
Thank you, Dr. Sudha. Sorry, in between the network has been troubling a bit. So my apologies for that. What reassuring, relevant, energizing, and I must say that a wonderful session by the great panelists. And my compliments to Team NPSC with Dr. Sudha and all the core members for enlightening us all on the core and relevant issues. At times, of course, we found that there are things which were so reassuring that whatever we are doing, we find relevance in that. And there are such guidelines which have been shared in such simple manners that, yes, as it was mentioned during the webinar or during the discussion, that within our own sphere of influence, we feel enlightened, we feel better that, yes, we can talk to children, we can talk to parents, and we can give them, extend that comfort to them. Because yes, lockdown happened all of a sudden, which was a simple process. But unlockdown definitely is not going to be such an easy task. Because I use a term here, I say that habitudes. It's the habits and attitudes, which have both been influenced, and something which happens for a longer period of time definitely has an influence on human mind. So number one, technically giving all the medical aspects and making us understand, Professor Arvind Kumar has done it beautifully. And I'm sure that all those who are not associated with the terminology and even a layman can understand it. And the beauty of explaining it is, so my compliments to Professor Arvind Kumar for making it so simple and so well understood to everyone. In its own way, Dr. Samir Parekh, who has been addressing the issues over the years, connecting with children, parents, and educators over the country. He has once again helped all us educators to understand the basics and using the terms like psychological first aid kit. That was something which is definitely a great takeaway for all of us. And we will definitely get in touch with Dr. Parekh to get more details on it. And I'm sure, knowing him very well, that he is always there to help everyone. So thank you, Dr. Parekh, for your wonderful insight. And Vikas Taneja ji, I'm sure that the way you have dealt with every question as it has been raised by the educators or the parents, and answering it from their perspective to make everybody understand what is desirable and how should we move ahead. So I feel that this was a very much needed session, because in spite of saying that, yes, we have all been trying to do our best and assure all the parents and students, as Ms. Aparajita is already here. So on behalf of NPSC, all the educators, I'm here to reassure all the parents and all the children that yes, we are soft, we understand, and we are open. We are very much open. And this discussion is in line to understand and to create that further openness and understanding, so that as it is not only the child's behavior, but it is even the adult's behavior which has taken a toll over this long period of time. So let us join hands together. Let us continue deliberating. Let us keep working. And there are no rigid policies. There are no rigid boundaries. Rather, we will keep working on it. We will keep discussing it. I'm sure every school, when they are in the process, they create a policy for a week and they are always open to listen to the parents and children. And they take decisions depending on the need of the hour. And we rely heavily on, the entire globe is relying heavily on experts like the panelists today. So we will keep listening to them. We will keep taking guidance from them. And this is one of its talk, but I can request all the panelists that as and when it is desirable, we will approach you again and we will seek guidance. We will seek support so that all our children and parents, as well as the adults, they are all reassured, they are all comfortable, they feel safe, and we have the responsibility. So let us collectively work together towards the betterment of our future generation. Dr. Sudha, thank you so much for enlightening us and creating this particular session. Ms. Meenakshi Shani, for your wonderful sharing of the session, and all Aditi ma'am, Meenakshi ma'am, and all the members who have joined, thank you for joining, because more the number of people who are able to listen to us, we are able to understand and we are able to echo similar sentiments, because it's all for our children. So I fold my hands and express my gratitude to all the educationists and all the medical professionals, as well as all the real heroes who from time and time again have been proving themselves, and we feel that they are always there to help the society. And let's keep working together. Thank you and Jai.
Thank you. Thank you, Mr. Sanjay. Thank you all esteemed panelists for joining us. It's an honor and privilege to listen to your words of wisdom. And many school leaders are listening to you, parents are listening to you. We will share the recording with other schools also. And thank you so much for sparing your valuable time.
Thank you.
We are grateful. Namaskar.